fragment in the right elbow, and we're probably going to do an ulnar osteotomy for incongruity as well. If you haven't already done so, please subscribe to our channel. Make sure you turn on notifications so you'll get a ding on your phone the next time we live stream. All right, so the hardest part probably of doing arthroscopy is identifying the proper ports. So what we'll do is we'll get you to make a fist with your right hand right there, and then we're going to break open. Might be easier to do it the other way. Yeah. And to break open, so we're going to put some lateral stress on that elbow. All right, and then the first port that goes in, we palpate the medial epicondyle and then go just distal to that. Try to drop into the joint space there. Okay? Then we're going to get another needle, and I'm going to advance it along the olecranon. Let me just grab a lap sponge, please. Which way do we need to go? Caudal. Okay, so then I'm going to take another needle and advance it along the olecranon. Try to get into the joint this way. Now you have to keep pressure, quite a bit of pressure on it the whole time. And then I'm going to inject some saline into the joint to try to make it easier to put the other needle in. Okay, so we've got saline coming out that way. Now, what I'll do is I'll grab an 11 blade, and I'm going to cut along the needle to get into the joint space. Then I'll get my trocar, which is here. We've primed. Yes, we have. All right, and I'm going to drop that trocar in alongside that needle and hopefully pop it right, and you're breaking that open quite a bit. Right in that joint. Let's just lift up, move your hand a little bit distal, your fist a little bit more toward me. Yep. And then break that open like that, and then push down. It's a fairly small joint. It's a small dog. It's a little quiche hound. Hopefully we've gotten in. Keeps wanting to slip out of the joint. Let's see if we turn on this, if we've got saline coming out. Yeah. All right, so I need to pull the trocar out. All right, and then we'll put the camera, the telescope in. Turn the light on, please. As in the light source. Okay. And then we flash and hopefully are looking at joint surfaces, and we are. Okay, so that's the ulna. That's the humeral condyle right there. Looking back caudally, we can see the olecranon, the needle that's acting as our egress, and then that's our large fragment right there. So that's a huge fragment there. Let's see if I can zoom in. All right, is there a way to zoom in? No, there's nothing there that shows it. All right, so then we need to access another port, so we'll get another needle, please. And I'm going to advance this needle just cranial to the other needle. Okay, and then jiggling that fragment around like that, and I'm using the needle to loosen the fragment. Now I'm going to need an alligator forceps, please. The other thing I want to look at is whether there's incongruity there, and it's hard to tell from this joint. The CT scan was very suggestive that there was a lot of incongruity there. Okay, so I'm just trying to loosen that up. A lot of synovitis going on there. Okay, so I've elevated that. Hopefully I'll be able to grab onto that with my forceps, although it's quite a big fragment, and there's even a chance that I would have to let's see if that's it. That's not it. That's a bite. So I'm just really trying to loosen that up, and the risk is that I'll push it, that I'll push it into the medial or the lateral compartment of the elbow, and then I'll never find it. I can see some attachments there at the bottom. All right, so hopefully that's loose enough that I'll be able to just pull that out. Can I get my blade, please? All right, I need you to hold on to this camera really carefully. All right, so I'm going to go alongside my needle to create another port. And you should be able to see the blade in there. So now I can remove that. Okay, I'm really trying to loosen that up. And then I'll grab my forceps and I'll reach in alongside my blade. Okay, and then I'm going to try to grab onto that, but sometimes they can be tricky to get out, and this one is absolutely huge. Let's move that back a little. Just a second. I've lost my port. Here we go. All right, and then hold on to that. Sometimes you even have to break up the fragment using an osteotomy. You always run the risk that you're going to push it back. Right. So there's the fragment there again. Okay, I've got it, and I dropped it. Okay, I've got a good grip on it now. Got a bit of it out. Okay, so look at the size of that thing. And now I'm really just trying to break down the attachments. It's almost too big to fit through the port. So twist it around and try to break down the attachments again. Can you hold on to the telescope, please? And I'll just grab a blade and see if I can extend my incision a little bit. Got such a good grip on it, I don't want to let go. I'm just going to try to twist it out. And just move that over a little bit. No, lost it. Look around here. Don't think that's it back there. I think that's just a bit of cartilage. There it is. Done exactly what I said I didn't want to do, which is I lost it laterally. I have to try to fish it out using a probe. There's a little probe here, there. Little ones, that's great, thank you. Need more towels here, please. Okay, so I've managed to pull it out again. Try to advance my alligator forceps without pushing it back into that space. I might try to grab it with a probe. And just try to advance it medially. As you can see, these can be a little bit frustrating. All right, let me try again. Do we have a, can you ask if we've got a cup forcep, a little baby cup forcep? It's a grabber, but it has two little cups. Is that bone?
Yep, there's somewhere in there.
All right, so I've gotten a large portion of it out.
We have a grabber, but it's similar to the one I opened up before. Yeah, it's a bite thing. So I think there should be one on the table with that. But we don't have the cut.
Got it. And even if you pull it into the extra articular space, that's enough, because then it'll just dissolve. Can you make sure that the bag is still pressurized?
Mm-hmm.
Thank you.
Yes, ma'am.
Empty?
Yeah.
You can tell that the field has become very bloody. So we're just replacing our pressure bag. So there's a question about causing OCD. There is no risk of causing OCD. This dog could have had OCD at the same time on the humeral condyle, which it does not have, which is from pressure from the medial condyle onto the medial cornoid process. So still looking at our big bone fragment there, and it still doesn't want to come out. You know what I might try is a regular hemostat. If we've got the smallest one, that's pretty good. Have one go with that. Just maybe flush in the back there, if you can connect it. No, it didn't work. No, all good. So just waiting for a new saline bag.
Just limited supply of these.
Yeah.
Scissors? Yes, please. Thank you.
Unfortunately, haven't got a choice. Just try to flush. I think that's come out. That's the problem. Okay, try to flush that through now. Big flush, yeah. Okay, that's great. Thank you. And we're dealing with a saline shortage in Australia, and so let me grab that forcep again. such a good grip on it. Got it. Okay, so that's our big fragment there. And that is out. All right, so I'm just going to get a curette now. There's a little one around there, maybe? No? This is a much smaller one. I had it out a minute ago. Is that it right there? Okay, and so I'm just going to try to clean up that area. That's the biceps tendon right there. Can I get some little gelpies, please?
Sure.
And I need 2 small homins. I'm just cleaning up that medial coronoid region. Okay, so that looks pretty good. And I've really tried to break that open. Let's see if we can see that radial head. I can't see it at all, unfortunately. So, but I feel like I need to do an osteotomy just based on the incongruity that I saw beforehand. So we'll go ahead and, or on the CT scan. So we'll go ahead and take out the scope now. And we'll bring the leg up like this. And can I get the table up, please? Thank you.
And just pumping the...
Yep.
Yep.
And I'll take another lap sponge, please. And can you go over to the controller and see, click on the down? Yep, click on that. And that'll take us to the full screen. All right, and then I think that's good. So we'll just stretch that out a little bit. And I will move the camera so we can see that. All right. So we are not going to do an intra-articular steroid. Can I get a blade, please? But I will do just some Marcaine before we leave. All right, so I'm making an incision on the palmar aspect of the leg. I'm palpating all the way through to feel the ulna, which is going to be right in here. Do I have 2 gelpies? And cautery, please. Thank you. Thank you. Okay. So that's the ulna right there. And then I need to get a homen on either side. Sure. Okay. Just grab onto that guy. Okay, so now we have the ulna isolated there. Just get a periosteal elevator of some kind. Thank you. All right, and then I'm going to make what's called a bi-oblique osteotomy. And I'm making a cut so that the proximal fragment, or the distal fragment, will interfere with the proximal fragment. And that'll keep it from subluxating. So I have to make sure that I make my cut in a smaller place. In that kind of direction. Yep. Do we have a skinnier one? I need long and skinny. Yep, that'll work. Thank you. And these do tend to bleed because you get that inner osseous vessel. Certainly not dangerous bleeding, but it's annoying bleeding. Yeah, it's not even bleeding that I have to tell the anesthetist.
Sometimes it's tough. I'm like, oh, that's where the blood is. And they're like, oh, that wasn't much. Like, it's not in the animal.
All right, so then I'm going to come in a proximal to distal direction. And I'm not worried about irrigating it because I want to kill the bone. So let's see if we've got a separation there. Probably not because it hasn't started bleeding. Okay, so that's separated now. And the idea is that as the dog bears weight, it's going to cause the proximal ulna to shift distally. All right, we can go ahead and take that out. Can I get some bupivacaine, please?
Sorry, what would you like?
Bupivacaine? Sorry, try to get it to focus again. Not sure why I'm getting it out of focus. Here we go. All right, and I just don't use steroid in this because the primary issue is the incongruity and the fragment. And steroids are actually not that great for cartilage. All right, so can I get some 2O PDS, please?
Yeah. Like, they try and put it inside the
And with these guys, can I get a thumb forceps, please? You do want to encourage controlled activity immediately after surgery because we're hoping to get some mobility in that proximal segment to improve the incongruity. Scissors, please. Hold on to that.
So you just had a splash block in that.
I've done a splash block, yeah, and then I'll do an intra-articular block as well.
Okay, how much did you put in there?
Splash, about what, 3 mils?
Yeah.
2 mils. Can I get some 2O PDS, please?
Some more to it, yeah.
3O, please. All right, so just to review, this is a little Keeshond, a couple of years old. It has a history of a right forelimb lameness, a lot of pain in the elbow and also on compression over the medial coronoid. So we did a CT scan and found a very large fragment and incongruity in the right elbow. And so we have gone in and removed the fragment, and we have done an ulnar osteotomy to try to improve the congruity in the joint. We'll go ahead and live stream in a second. If you haven't already done so, please subscribe to our channel. Make sure you turn on notifications so you'll get a ding on your phone the next time we live stream, and we will see you again soon.
Did you answer this question, Charles?
What was the question?